My name's Elizabeth Hales, and I am a retired teacher and the grandmother of 2 rambunctious little grandchildren. I began to have all this pain across my shoulders, radiating down my arm, and had no clue what was going on. I thought maybe I'd hurt my back, and then it turns out that I had a tumor in my spinal column, and that was affecting the nerves and causing all that pain.
So I met Elizabeth, actually got a call from her pain management doctor. She was having such severe pain from this tumor, and she hadn't been able to get relief, so he called me and asked me to see her. When I saw her, she was in a wheelchair, severe pain, kind of wit's end about how to manage it, really weak in her legs.
Pretty much doing anything was painful. And playing with grandchildren, holding them, holding little babies up like this, things like that were impossible. It was hard for me to even have my grandchild sit in my lap while I read a book to her. And that was very upsetting.
So this type of tumor is actually quite rare. It's about 1 in 100,000 people will have this tumor. So it's a very rare tumor. But when we get them, particularly where she had the tumor, it can be quite devastating and usually require surgery.
I went in and had surgery.
It's always challenging. You know, we're dissecting something right off the spinal cord, and it was quite a large tumor, so part of that, we have to debulk the tumor internally just to relieve the pressure, to kind of give us some more mobility to the tumor, to be able to identify where the nerve's coming in and where the nerve's exiting.
But when I was done, the extreme pain that I had going down my arm and through across my shoulders was gone. I had surgical pain for a while, obviously for healing, and as time went on, that got better and better. So it was a really good result. And I had even been dragging my right foot and having a hard time walking before, and that has gotten tremendously better, and I'm walking much better than I have in a while.
She's doing great. Her pain is completely gone. She has some post-surgical pain, which is very minor. Her function has returned to kind of her baseline. She's walking a lot better. She's very happy with the outcome. You know, it's really great to see that improvement.
I can pick up my grandson. I can play with them. I can throw a ball. I can do things with my grandchildren, and that's really important to me. And I was just very grateful, very, very grateful.
Part of the reason why we do what we do, and the what's so rewarding, is taking people who are in such severe pain and being able to restore function and be able to restore their quality of life. And that extends beyond tumors. You know, a lot of the spine surgeries we do are to restore function and relieve pain. And seeing people come in smiling and say, I forgot what it's like not to be in pain anymore, is really rewarding.
I would definitely recommend Dr. Engler and UNC Health to someone who was having problems similar to mine, because the outcome was really outstanding. My quality of life really changed. I was really upset because I thought that this was going to be an ongoing problem, and I didn't know what I was going to do. And Dr. Engler was very direct and very encouraging, and did a great job.